CTV Calgary, local breaking news.
Good afternoon. Calgary police remain at the scene of a suspicious death in Canyon Meadows. Investigators say on Thursday morning, a woman in her 80s was found dead in a home on Canterbury Gardens. Detectives have been speaking to neighbors and gathering security camera footage from the area. It's unclear why police are treating the death as suspicious. An autopsy is scheduled for today. An urn stolen from a Chestermere home has been returned. The ashes of Deanna Thompson's mother were discovered this morning outside McInnes and Holloway on Memorial Drive. There was a note asking for their safe return to the family. Police are still looking for two men in connection with the theft. Alberta doctors say emergency departments across our province are in crisis mode. Less than 3 weeks after an Edmonton man died waiting for hospital care, long waits and crowded rooms still punctuate health centres. Tim Brooke reports.
John Henn waited 3 full days inside the Peter Lougheed Centre emergency section.
I was counting ceiling tiles. I brought a sociology textbook. I finished it in the first 24 hours, and then after that was just listen to music, I guess.
A boring stay for needed help, but Henn says he's lucky. He actually had a chair to sit and wait in.
It just seemed like they didn't have places to put people, and then all of the upstairs units were full, and that just caused massive backloads downstairs.
Across the streets, Avo Wahlberg is still waiting for his 90-year-old mother who broke her hip.
She's been in the hospital now for 3 days, but it's an emergency in the sense that the physicians feel it should be done within 24 hours.
Doctors tell us it's past time for the province to step in.
Our entire province's healthcare system is in crisis. We need to declare a state of emergency.
Doing so would allow for temporary measures that may improve the system. It could mean emergency funding or load leveling, which would move patients out of busy centers and into facilities that can handle them.
Often, frequently, we have people in 10 out of 10 abdominal pain with no pain medications, no comfort, nowhere to sit comfortably for 12 hours in our emergency department because we can't get them in.
In the last 24 hours, we've seen the queue at Rocky View exceed 5 hours and the one at the South Health Campus reach 8 hours and 20 minutes. At one point, the wait at Peter Lougheed was 10.5 hours. Even those staffing Calgary's fastest emergency department say they're underwater.
So right now, today, we're 130% over capacity. We've started doubling up rooms on most of the different floors of the units to handle the increased patient load.
Alberta's minister in charge of hospitals and surgical health services denied a CTV News interview request. A statement says the province will continue to monitor system pressures closely and work with health system partners to respond to challenges as they arise. It adds recent investments in acute and continuing spaces should alleviate some concerns soon, but the government will not commit to declaring that state of emergency. It's not what many doctors want to hear.
I would just respond, how many more patients have to die in our waiting room before they'll step up and show some leadership?
Tim Brooke, CTV News, Calgary.
And we've seen nearly 2,000 more hospital admissions for the flu this year compared to the same time last year. But doctors say rapid population growth and underfunding are the major causes, and clogs at the continuing care level are making matters worse by taking up valuable hospital space. Repairs on the Bears Paw feeder main are progressing, but the city warns the water supply is still vulnerable. On Wednesday, Calgarians used 508 million litres of water, above the target of 485 million. The new pipe is now in place, and crews will start repairing the road once the pipe is tested. As the pipe refills, city crews may release water through fire hydrants to ease pressure if there are signs of stress. Other safety measures will be put in place in case of another break, including modifying flood barriers and deploying temporary pumps to clear out water. The fire department says if Calgarians don't do a better job of conserving water, it puts firefighting at risk. The city is calling for households to reduce their water usage by 30 litres a day. Car washes recycle 85% of their water, so they don't fall under restrictions. Recreation centres are closing their steam rooms and reducing wave pool hours to demonstrate a community approach. Calgary's Firefighters Union is pleading for cooperation.
It certainly can reach critical levels very quickly in the event that we either have a what we call a dry hydrant or frozen hydrant this time of year, or something with low pressure like our trucks. And firefighters, we depend on high pressure, high volume water, during an incident.
Water restrictions will remain in place until emergency repair work is complete and water service goes back to normal. New data from Statistics Canada shows Alberta lost 14,000 jobs last month. That brings Alberta's unemployment rate to 6.8%, on par with the national unemployment rate. In total, across Canada, there were 1.6 million people looking for work. That's an increase from November of more than 70,000. The youth unemployment rate took the biggest hit, with Canadians between 15 and 24 losing 27,000 jobs. A ceremonial groundbreaking marking the start of work at a hotel on the Stampede grounds. The 13-story Autograph Collection Hotel by Truman will be located across from the BMO Centre. It will feature 320 rooms, meeting and ballroom spaces, restaurants, a coffee shop, a rooftop lounge, a pool, fitness club, and more. Construction is anticipated to be completed in late 2028. Thanks for joining us. We'll have more on the top stories coming up on CTV News at 5 and 6, or anytime online at ctvnewscalgary.ca.